Kia ora. We've opened up consultation on repealing and replacing the Mental Health Act. The Mental Health Act is legislation that sets out how, why and when the government can intervene in a person's life and give them mental health treatment against their will. A really important part of the consultation is hearing from people impacted by the Act. People with lived experience, Māori, Pacific people, disabled people, family and whānau, and young people. I'm here with John Whaanga, Deputy Director of Māori Health, to talk about how we can create mental health legislation that is unique and tailored to Aotearoa New Zealand.
Kia ora, Phil. Look, I think the first thing for me is it's really important that Māori are engaged in the review of the Act. We are disproportionately impacted and have been disproportionately impacted by the provisions of the Act, including compulsory treatment. And so I think it's really important that Māori are engaged so that we can point out where the issues are for us, but also where the solutions are. I mean, there's a real opportunity to create something that's more purposeful, to create something that's fairer, and to create something that's much more appropriate. And for that to occur, we've got to have a wide range of people engaged.
Yeah, thanks, John. Look, the current legislation doesn't reflect Te Tiriti of Waitangi. Now, what are your thoughts about that, and what are your thoughts about that moving forward?
Again, a really important reason as to why Māori need to be engaged. We can't develop our responsiveness to Te Tiriti of Waitangi in isolation. We can't do that alone as the government. We need our treaty partners. We need to be engaging with Māori. We need them to help design something that's more suitable. But I think most importantly, developing an appropriate, suitable and fair approach to this in the future cannot be done unless we have good engagement from our community. It's absolutely critical. I can't fill in all the blank questions on behalf of iwi and Māori out there. They have to be engaged in that. I might be able to say to people, here's what I understand people are saying, but that's never the same as being able to hear from those people directly. And I stress again, we don't know what all the solutions are, but we know that through a process of engaging with our people out in the communities and those who've been impacted on in the past and currently, we will design something that's more suitable for us, and that's going to be important for us, not only for us, but for our children and our grandchildren. And I think that's the opportunity here.
Kia ora, John. Thank you very much for your time.